At Bayer, we started to really work out a complete strategy of open innovation, um, but also being aware that we want to really focus on areas of interest for us. So we've got a really well, now phrased out and organized strategy with G4A, which is something that was built over years. So G4A started now more than 12 years ago, and it's helping us not only to connect with the ecosystem of digital entrepreneurs, but also to stimulate that ecosystem. Basically, we started to really think we need to accelerate, if not sometimes create, the innovations and the companies we want to collaborate with. So this is really where pharma is working on. We also have a lot of activities of connecting with the external environment with crop science, and at the corporate level, we have LEAPS. LEAPS is our arm investing in early and disruptive innovations that can change really the world, whether it's in for crop, for consumer, or for pharma. The way we are going now to observe how productive we are in open innovation, it's going to be objective KPIs on how many companies we actually were able to sponsor or help or see coming our way. We are really looking into the track record of G4A in this way. We have now more than 24 growth track companies that are being developed with our help from the beginning. And I've got to say we are extremely proud on how this program really helped companies get off the ground. Now, those companies account for more than 70 millions of funds being raised over time. I also have to say that we have a lot of companies that made it through time. You know that in digital, there are a lot of good ideas coming up, many very, active entrepreneurs, but the survival rate of companies is becoming an issue. And we are extremely proud because vast majority of the companies that we sponsored and helped and really followed over time are still around, and they are still existing and raising funds and being successful doing so. When we talk about the track record of G4A, the growth track companies are now accounting for more than 122 millions in funding for all the alumni we've got. Now we've got the advanced track, which is for the slightly more mature company, where all of those, we've got more than 80% of those ones still being around, with close to $1 billion of funds accumulated by those entrepreneurs. And if we calculate the total alumni value, it's 1.8 billion. So we made the right choices. We probably contributed to the successes, and some of them are going to contribute to really raise the value of digital health and become potentially strategic partners for us down the road. We have been going through, I would say, a maturation track ourselves. At the very origin of the interactions, there was this bit of old directions going and trying to tap into digital innovation. We have been reshaping our way of operating with the digital ecosystem in really focusing on what can help our purpose. In the beginning, we were very much focused also on helping directly our businesses. And, at the initiation of G4A, it was really meant to support our brands on the market. We progressively shifted our focus to have more companies working on digital health and the potential disruption of the healthcare systems and healthcare value chains through those innovations. And that's how progressively we shape differently our challenges that we are posting out to help tackling the weaknesses and the potential value pools of the healthcare system. We also now are integrating many more activities around how to handle data and looking into partners who can actually help us transform our own value chain and the way we create value. And this means we are really looking into everything related to artificial intelligence, data acquisitions, machine learning, predictions, all those things that can help us to change the way we operate from research to commercial. And this is, I would say, a trend that has been emerging over the last 3 years, roughly. During the last now 2 years, like any company, we have been impacted by the pandemic and the consequences of the pandemic. And there are positive things and less positive things. On the less positive things, I've got to say we are missing a lot. The face-to-face contacts and our direct exchanges with entrepreneurs, our ability to put together innovators into the same room. And this has been really a problem. On the other hand, what happened during the pandemic with the lockdowns was everything which is now different. It really boosted the digital interactions, and it actually catalyzed a major change in the way healthcare is practiced. A lot of things that were deemed to be impossible or blocked by regulations or blocked by the legal framework here and there, all those things are now becoming real. Telehealth, teleconsultation, gaining time for patients, not exposing them to waiting rooms. All those things that we thought would take ages to happen are now becoming kind of a common thing across different geographies. It also means that from the institutions, the government's point of view, things changed, really changed into, yes, it is possible. And yes, by the way, there is value into gathering data. And yes, maybe we need to change the way we practice. So it's still not completely there in terms of transformation, but it has been really an accelerator. And also it has been making sometimes the demonstration that, yeah, it's possible, it's feasible. And we should really adopt it because it's going to bring value to our different systems. At Bayer, we're really now at a stage where we are thinking about continuing our investments and continuing to fuel the ecosystem around us. But we are going to focus also in solutions that can help us harnessing the power of data. Medicine and biology are producing a tremendous amount of data. Now we have many ways of generating more data. And we realize that harnessing the power of those can really help finding new solutions to help us doing our work as an innovator faster, bringing solutions and new treatments faster to patients, tackle problematics that were out of reach so far because of their complexity. And I think it's going to be one of the key areas where we need to see innovation from the outside reaching us inside. And I really hope G4A can continue helping us doing that by stimulating this ecosystem. We need the science to really integrate these ways of working with all the power of machine learning and artificial intelligence. We are collaborating already in R&D to find new molecules based on the use of data and complex data and modeling interactions with proteins and chemicals to tackle what we told was undruggable before. And I think it's a very nice and interesting application. In digital health, there are also a lot of things we can do by better understanding patient data, by integrating patient data and continuous data that are arising with sensors. And we are going to continue with the help of G4A to stimulate the ecosystem and to work with the open innovation environment to come to this point.